Hello, friends. Let us start the third part of the chapter State Government and its role in health in our 7th class civics. Students, here we start with the topic healthcare services. If we see India, then here we found two type of healthcare services: public healthcare services, private healthcare services. Let's first do the public healthcare services. The public health services are health centers and hospitals which are run by the government. It provides treatment to all kinds of problems at all level. At village level, we found public health centers where nurses are available. The village health workers trained under the public health centers of PHC. Anganwadis are there. There are two nurses in these Anganwadis who take care of both mother, a pregnant lady, to till when a lady become a pregnant to a child of 5 years of age. They see their nutrition, their whole card of giving medicines, vaccines, injections, etc. And also they regularly watch and give them nutritious foods, both to mother and children, his children. Then we found district level. District level hospitals, they are supervised by the health centers. They are found in the main city known as the civil hospital of that district. So from district civil hospital to our village area at each level, from whether a village level, a block level, or a district level, there are public hospitals and public healthcare services are provided by the government. Its main aim is to provide quality healthcare to all the people in a very less cost so that everyone can seek treatment. The treatment should be or the medical facility should be affordable for all the people. Government also take action against the spread of diseases like TB, malaria, jaundice, cholera, etc. And another work of the government is to spread awareness among the people. This is how we see the role of the public health centers to provide healthcare services to all. Now, let us come to the private healthcare services. In rural areas, the registered medical practitioners means the government practitioners, these practitioners who are sanctioned by the government but they are running their own private business. They are actually not interested in rural area. Basically, they like to urban doctors, specialists, many hospitals, nursing homes, laboratories, pharmaceutical shops, etc. These all comes in private health facilities. They are not owned, controlled by the government. Take a lot of charge for their services. To provide best health services, they need money, and for that they take a lot of charges. These services are spread throughout the country but in the urban areas only. And we can see here in this diagram also whether a district whether state or in India. This color is of state and this one is of India. We see the development of the hospitals in India are increasing, but instead of public, the private health centers are developed too much in India instead of government hospitals, which are not affordable for all the people. Now the problems which we are facing, that the lack of public health services, because the people in the rural areas are not available in urban area. It is not reachable for them to go to these doctors. Expensive services are provided by the private sector, which is also not possible for the poor people. They are unaffordable by them, and the profit they encourage and we also see that there are some private hospitals who encourage unfair practices so that they can earn maximum profit. So one more thing which we see is the women health is also neglected in these areas. As you can see here, if we see the rural public area, then here also they doesn't get proper facilities. People are too much, but the doctors are very less. Cleaning facilities are also not there. So this is how problems are also faced by them. That's all in the chapter. Any kind of problem and doubt, if you face, you can send your comment. I will definitely reply you, or you can visit my blog also, which is bipinyoga.blogspot.in. That's all in this chapter. Thank you so much.